Afternoon to all of you. Let me show you and present a case that I have followed with Professor Perry in Ferrara. This is a 63 years old lady who has a history of hepatitis B and diagnosed with unilateral conjunctival molten lymphoma back in 2001. And then she developed 5 recurrences after surgical excisions. In December 2013, this was her clinical picture after recurrence number 5. And later on, in March 2017, she came to us once again with an increase of the lesion, and she asked us to do something. And therefore, at this point, the patient has been restaged with a total body CT scan and blood tests, hematological examination, and also a CT of the orbit in order to rule out the orbitary segment. All negative tests, and so there was no evidence of extraocular involvement by the lymphoma. At this point, I would like to ask you to cast a vote. According to you, what could the treatment be for this patient? A new surgical excision plus cryotherapy, radiotherapy, interferon alpha injections, or rituximab treatment.
Bene, vedo che siamo un po'.
Okay. The varying opinions, because honestly, there isn't a correct answer. Because everything is possible here. But we decided to rule out once again the surgical excision because, however, in previous surgeries they had failed, and also because the lesion this time was quite extended. As to radiation therapy in our center, we do not perform it, so the patient was referred to another hospital, but she decided to reject this treatment, although we know that it is very effective in most of the cases, because she was really afraid of side effects. And in addition to that, she would have to move for 20 days to another town. So we consider the interferon alpha injections or rituximab. As far as rituximab is concerned, we actually ruled it out because in the literature cases, the reactivation of hepatitis B is reported. So we the systemic treatment might be better in case of orbital involvement or involvement of the fellow eye. And so we didn't want to have this involvement, so we went for interferon alpha injections. There are several case reports in the literature. The more extensive one is the study by Professor Balestrari in this group, research group. So 85% on 17 eyes, no recurrence, and the median follow-up was 65 months. So we decided, we initiated this treatment. 3 MAUI a week for 4 weeks, and we started in May 2017 after the first 4 injections. So about 1 month later, this was the appearance. So the lesion was smaller, but it is still quite extensive. So let me ask now, what would you do now? So should we suggest once again a surgical excision or radiation therapy in order to see whether it might be more effective now, or to keep doing injections, or to just discontinue treatment?
Vediamo I risultati.
The results here. unclear. So we decided to keep to continue with the injections. In total, there have been 9 injections. These are the pictures in August 2017, so after 9 weeks, and this is the follow-up after 11 months. We saw her in June, and there were no recurrences. So there are several options for these patients. What really matters is to consider them all and try and identify the best one for this specific